Now, friends, heart failure with preserved ejection fraction still remains a misery for so many extent. We all know HFrEF reasonably well as far as pathophysiology, the reasons, the entire gambit is concerned. But HFpEF is not as well understood. HFpEF basically, if we want to mention in one word or one line, is a massive systemic inflammation where there are multiple comorbidities producing a lot of inflammation in the body where heart gets secondarily affected. But obviously, patients do have symptoms of heart failure with ejection fraction more than 50%. A very interesting point is once a patient has got either HFrEF or HFpEF, once they've got symptomatic heart failure, their prognosis is roughly same. So that means even the patients of HFpEF should be recognized very well, quite early in time, and they should be treated aggressively. Unfortunately, we have very minimum molecule and very scarce data as far as treatment of HFpEF is concerned. There are 2 molecules or 3 molecules which I considered very useful. Number one principle is in patients with HFpEF, treat all the associated comorbid conditions. It may be ischemic heart disease, it may be hypertension, it may be diabetes. Treat them to the target. Patients might have anemia, CKD, atrial fibrillation, COPD, asthma. Treat them to the perfection. Then there are 2 or 3 molecules which can be used. Number one is SGLT2 inhibitors, which has got a reasonably good data that if you give SGLT2 inhibitors in patients with HFpEF, they get benefit as far as admission to hospital is concerned and mortality is concerned. The second most important molecule comes ARNI. ARNI had a wonderful data called as PARAGON-HF, where though the entire trial just missed a little bit as far as p-value is concerned in terms of reduction in HHF, that is hospitalization for heart failure and mortality, but women did get tremendous benefit by use of ARNI in HFpEF, and so the patients who had ejection fraction less than 60%. So all those patients who got HFpEF with ejection fraction less than 60%, all those patients of HFpEF who are female, they should be treated with ARNI, maintain routine precautions.